This is our fifth webinar, and we are very excited to spotlight the topic of social challenges in follow-up care today. And we are really excited to have such a diverse audience today. There are many survivors and carers, policymakers, healthcare professionals, patient organizations, and many others from at least 29 countries. So that's really great. Welcome to everybody. How important do you estimate social support? Oh, that seems to be very clear so far.
It's always very important to work interdisciplinary, and also because all of our healthcare professionals have a little bit of different focus. So you as a psychological, or me as a social worker, or the physicians have some other focus in aftercare. So when they are coming for the appointment, for the checkup, they focus on different things. So my recommendation would be that also the social dimension have to be a little bit more in the mind of the healthcare professionals, and it would be great that social workers also very to work integrative in the aftercare with the late.
To be honest, I do not know the details, and there was quite recently there was a change in Switzerland. So far, only how is it called in English? Psychiater were covered. So really, someone with a medical education could
psychiatry.
Psychiatry could be covered by the insurance and the healthcare system. But as far as I know, this has been changed, and now psychologists can be.
Mental health aspect was being openly addressed. Therefore, I was thinking, okay, that there's something wrong with me. So I was taking it very personally, and it was hitting my, my self-confidence very much. On the other side, I was accomplishing, I was 23, being a founder of a patient organization in Poland, and seeing the world and seeing the needs of how much needed to change. And that was such a, like a two sides of the story, basically. So knowing what I wanted to change, or bring the change, or address the changes, and experiencing them myself, it was really a hardship.
Yeah. So, but this doesn't happen by accident. So I think that one of the very important things is that we need the healthcare professionals and the parents to understand how to do a really good transition. Now, of course, the problem is many of our young people have nowhere to transition to. Okay, but even if they are transitioning to a position of self-advocacy in not a very efficient system, I think the idea of collaboration and us working together, and some of the things that we've done in Childhood Cancer Ireland is run advocacy workshops on self-advocacy, both for the parents and for the young people, because we all live in imperfect systems.
All our visions, what we want to have in 10 years' time, because really don't hesitate to write everything in there, because we really want to take this with us. We want to learn from it. We want to work on everything, work on it together, and move things forward. Yes, accessibility, of course. Support has to be accessible for everybody. Yeah, acknowledge the challenges, talk about it. Very nice. More understanding. You can see it here. The previews or the next webinars will be on long-term follow-up care in January, and in February on transition. So we are really looking forward to that. And also, if you have not already done so, we really wanted to ask you again to fill out our survey. Both surveys are out there at the moment on long-term follow-up care and mental health and psychosocial care, because we really, we need your experience to move things forward. So if not already done, please take some minutes and fill out the surveys.